Today we're going to talk about surgical care, surgical designs, and suturing techniques. In the next couple of minutes, I want to talk about the incision designs that should be made in the mandible or in the maxilla when you're dealing with dental implants. And there are a lot of different approaches that you can use. Where do you place your incisions? Mid-crestal, palatally, is it single teeth, is it multiple teeth? Today we're going to talk about the edentulous mandible and where do we make our incision. Now, soft tissue around implants is different than soft tissue around teeth in that the way it attaches to the implants versus to the tooth. As all of you know, the tooth has a periodontal ligament where the implant does not. The fibers are horizontal with the tooth. They go directly into the tooth, and with an implant, they're parallel. So they're a little bit different. But still, what we found out over the last number of years is that we do need keratinized tissue around implants if we're going to have a healthy situation. It's going to be more resistant to inflammation, easier for the patient to clean, and the patient is usually more comfortable when they have a healthy band of keratinized tissue. So our goal in surgery is to have a healthy band of keratinized tissue around dental implants. Here's just a photograph or a picture of the difference in fibers around teeth with implants. You can see they're horizontal around teeth and they're vertical to the long axis of the implant when you have soft tissue around an implant. Now, there are different ways to make your incision. You can make it mid-crestal, you can make it palatally, you can have multiple teeth, single teeth, or you can make a buccal approach. What we're going to talk about right now is a mid-crestal incision in the mandible and why that's necessary. In the mandible, mid-crestal incision is the incision of choice because in the mandible, as opposed to the maxilla, you have two mucogingival junctions. A lot of people don't think about that. You have a limited supply of keratinized tissue in the maxilla, but in the mandible, you have a minimal supplies. It's delineated by the mucogingival junction on the lingual and the mucogingival junction on the buccal. So that keratinized tissue, you want to have equal amounts both buccally and lingually so that you have healthy tissue not only on the buccal side, but it's the lingual side as well. So if you look at an edentulous mandible, and this could be a second stage surgery or a first stage surgery, you can see those two arrows delineate the keratinized tissue. You want to make a mid-crestal incision so that you have equal amounts of soft tissue, both buccally and lingually. This is an old case. This actually is one of my first edentulous mandibles, and I did this case back in 1988, where we made a mid-crestal incision. We exposed Brandenburg implants. These were the original Brandenburg implants. And as you can see on the right, we have equal amounts of keratinized tissue on both sides. Back then, you can see the external hex Brandenburg implants. It's sort of a throwback, and you also see a throwback to suturing. I did that with interrupted black silk sutures, and we haven't used black silk sutures in our office in probably 24 years for a number of reasons that we'll talk about in one of our next videos. So you can see in the picture on the right, equal amounts of keratinized tissue, both buccally and lingually. And here's the final restoration. These implants were placed in 1990 with healthy band of keratinized tissue with the old high and dry Swedish flying denture. And it's a very healthy result. So when you're doing the mandibular surgery, look at the keratinized tissue, look at both mucogingival junctions, and then make your incision appropriately. I like to usually go mid-crestal. Here's a second stage surgery on some mandibles in the anterior mandible. Implants in the anterior mandible, and you can see healthy bands of keratinized tissue on both sides. And we have sutured that with this case Gore-Tex sutures, which don't work bacteria. And here is the final result with healthy keratinized tissue, both buccally and lingually. Thanks for listening today. Hope that tip was helpful to some of you who don't do a lot of surgery in the mandible. Those of you who do, always take a look at the keratinized tissue. Very important. Have a great day, everybody.